Let's study fat-soluble vitamins in 3 minutes. Vitamin A includes retinol, retinol, and retinoic acid, which is found in the liver and green leafy vegetables. It is a component of the retinal pigment rhodopsin, which is involved in epithelial cell maintenance, normalizes keratinization, maintains germinal epithelium, and plays a role in hematopoiesis. Deficiency leads to nyctalopia, corneal ulceration, hyperkeratosis, immunosuppression, and growth retardation. It is due to poor diet, pancreatic insufficiency, malabsorption, and liver disease. Excess causes teratogenesis, pseudotumor cerebri, alopecia, and dry skin. ATRA is used to treat AML. Isotretinoin is used for acne. It is also used in measles prevention. Females are encouraged to take a pregnancy test and 2 forms of contraception before isotretinoin use. Vitamin D includes cholecalciferol and ergocalciferol. It is found in the sunlight, plants, milk, and fish. 7-dehydrocholesterol is converted in the skin into cholecalciferol. In the liver, it is converted into 25-hydroxyvitamin D, and in the kidneys into 125-dihydroxyvitamin D. Functions include intestinal absorption of calcium and phosphate, bone resorption, and distal tubular kidney resorption of calcium. It also downregulates the parathyroid hormone. Vitamin D deficiency results from limited exposure to sun, dark skin, chronic kidney disease, malabsorption, dietary insufficiency, and exclusive breastfeeding. It can cause osteomalacia in adults, rickets in children, with characteristic cupping and fraying of metaphysis, craniotabes, rachitic rosary, and genu varum, along with muscle weakness and bone pain. Serum calcium and phosphate levels are normal, whereas alkaline phosphatase and PTH are increased, along with decreased vitamin D. Excess causes hypercalcemia, hypercalciuria, and psychosis. Give oral vitamin D to breastfed infants. Vitamin E includes tocopherol and tocoretinol. It is found in nuts, seeds, and grains. Its function includes acting as an antioxidant, maintaining the integrity of cell membranes, and help protect against neurodegenerative diseases. Deficiency causes hemolytic anemia, ataxia, decreased vibration and proprioception, muscular weakness, and hyperreflexia. Main risk factors include pancreatitis, fat malabsorption, celiac Crohn's, and cholestasis. Excess causes enterocolitis in infants, bleeding, and hemorrhagic stroke. High doses decrease vitamin K metabolism and enhances warfarin activity. Deficiency presents similar to vitamin B12 and Friedreich ataxia. Vitamin K includes menaquinone and phytomenadione. It is found in lettuce, pumpkins, and eggs. Functions include the gamma carboxylation of glutamic acid residues of clotting factors including 2, 7, 9, 10, protein C, and S. Deficiency causes hemorrhagic disease of the newborn. Etiology is low stores of vitamin K in a sterile infant gut, poor placental transfer, low quantity in breast milk, and antibiotic use. Signs include umbilical bleed, sunset eyes, bulging fontanelle, intracranial pressure, or bleeding. Labs include increase in the PTA and APTT, but a normal bleeding time. Excess causes jaundice, hemolytic anemia, and kernicterus in infants. Warfarin inhibits the vitamin K. It is not present in breast milk, so it is given in the intramuscular injection form to infants. Bye.